reproductive system? Are we talking about the whole disease area that actually have women as patients? Also, then we discuss some business cases of other and case studies of other therapeutic areas that had also problems in funding, and funding was challenging, and how have they overcome those challenges in order to see and preempt some of the discussions that we will have. We then started to enumerate and to map what are the current initiatives that exist from all of our amazing participants that exist nowadays that help the funding and of innovation in women's health. And from there we started to go to the what if. What if we do something different? What would be needed? And I think there are 4 main points that we came to, key takeaways, and very interesting. It was nice to see that both in the morning and in the afternoon, through different paths that both groups took, they came to more or less the same conclusion. So I really think these are very strong ones. So first of all, and as well already mentioned by other moderators, was about breaking the silos. There is the silos across R&D value chain, especially when we talk about basic research, the applied research, and how can we break it? It has to be a collaborative effort here. And this collaborative effort actually in terms of, for example, a foundation or in terms of a whole group getting together, actually it's of major interest of big pharma companies. Because as well, when we see where the funding that currently we have, little or not, is being spent, we can also clearly understand where are the gaps that need more funding. As well, when there is a collaborative effort in the community, entrepreneur can really find the researcher and the research that is needed in order to raise the funding for that. So really bringing people together here. As well, it's very important to do a systematic review to understand the moonshots and to identify the moonshots, to identify the cases that in which companies have been successful, have great exits, so that investors are interested, so that we can create a hype. And this is also interesting to go both on the chronic indications of women's health. I really like the example of going endometriosis and RA. I find it very interesting. And as well to map here what are the short, mid, and long-term points. And then we come to the point of when we do this systematic review, it's as well very important to have the health economics and the business case. And we'll completely agree, because we need that. There's a positive business case is needed to bring to the table to make decisions, because that is what it will be supporting those points going forward and direct the funding, because it all comes to that at the end. And on the more long term, we have here the regulatory incentives. As I said, we had the look at the different therapeutic areas and regulatory incentives that other therapeutic areas, like for example, orphan indications, had in the past. So would these incentives also make sense into women's health? If we put here, let's say we use that analogy a lot in our workshops, the carrot in front, and people do see that they would have incentives if they develop in women's health with higher patent life, would have maybe R&D costs being tax-free or things like that, like we have seen in other therapeutic areas. This would lead that more people will see here a business case, and actually it will help to create the business case. So it's all connected. And we do think that in short term, creating this systematic review and understanding the moonshots in order to create the hype is more tangible in a short term. In mid-term, this will help to create the health economics and the business case necessary for that. And then in the long term, we'll have here these collaborative efforts, and as well the regulatory, as well coming from lobbyism as well, regulatory coming in order to bring the fundings here. So it's a long path, but it's possible, of course, because it has